What if I told you that the swelling in your legs and ankles isn't just water retention, but an early warning sign that your body is quietly losing its ability to circulate blood the way it used to? I've been in surgical practice for decades, and I can tell you one of the most common things older adults overlook is also one of the most dangerous when ignored. Patients come in thinking it's harmless, just a little puffiness by the end of the day, tight shoes, deep sock marks. But when I look closer, I often see something deeper beginning to unfold because that swelling, it's not random. It's what happens when the natural pumping system in your legs starts to slow down, when fluid begins to pool instead of move, and your circulation struggles against gravity. And here's the part most people don't realize. This doesn't just affect how your legs look or feel today. It can quietly impact your mobility, your balance, even your independence over the next few years. The good news? There is a simple, almost overlooked movement that can help reverse this, if you catch it early enough. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. The ankle pump, your number one daily reset. There's a simple test I often ask my older patients to try. Right where they're sitting. Lift your feet slightly, move your ankles back and forth, and notice how stiff, heavy, or even tight they feel. That sensation alone tells me something important. Your circulation has slowed down more than you realize. What many people over 60 don't hear often enough is this. Your body doesn't just rely on your heart to move blood. Your lower legs have their own built-in pump system, and it depends almost entirely on movement. When you're sitting for long periods, whether it's watching TV, reading, or even driving, that pump essentially goes quiet. Fluid begins to settle downward, pulled by gravity, collecting around your ankles and feet. That's when you start to see swelling, feel tightness in your shoes, or notice those deep sock marks at the end of the day. This is where the ankle pump becomes incredibly powerful, not because it's complicated, but because it directly reactivates that natural circulation system. Here's exactly how I want you to do it. Sit in a firm chair where your feet can rest flat on the ground. Make sure your back is supported so you're not straining. Now, gently lift both feet just slightly off the floor, just enough so your heels are free to move. From here, slowly point your toes forward like you're pressing down on a gas pedal. Hold that position for about 1 second. Then pull your toes back toward your body as if you're trying to point them up toward your face. You'll feel a stretch through your calves and maybe even behind your knees. That forward and back motion is one full cycle. Move slowly. This is not about speed, it's about control. Aim for 20 to 30 repetitions in one session. As you continue, you may start to feel warmth building in your lower legs. That's a good sign. It means blood flow is improving and fluid is beginning to move again instead of sitting stagnant. For best results, I recommend doing this at least 2 to 3 times a day. One of the most effective times is in the evening, when swelling tends to be at its worst. Another great opportunity is after meals, especially if you tend to sit for a while afterward. Even doing this during a commercial break can make a noticeable difference over time. Now, here's something important to understand. This movement is not just pushing fluid around. It's actually helping your body restore balance at a cellular level. When your circulation improves, oxygen delivery improves, waste removal improves, and those tiny pumps inside your tissues start working more efficiently again. That's how you begin to reduce swelling naturally without relying only on medications. But consistency is everything. Doing this once won't change your day. Doing it daily can change how your legs feel entirely. And if you've ever felt that heavy, tight sensation creeping in by late afternoon, then what I'm about to show you next might surprise you because there's another simple movement that can activate your second heart and push that fluid out even faster. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Heel raises. Wake up your calf's second heart. If your legs tend to feel heavier the longer you stand, or if swelling seems to creep in by late afternoon, there's a very good chance one key system in your body has gone a bit quiet. I'm talking about your calf muscles. Most people don't realize this, but in medicine, we often refer to the calves as your second heart. And for good reason. Every time those muscles contract, they squeeze the veins in your legs and help push blood and fluid back up towards your heart. Without that push, gravity wins, and fluid settles right into your ankles. Now, here's the problem I see every day in older adults. As we age, we naturally move less, stand more passively, and those calf muscles stop doing their job efficiently. The result? Swelling that seems to come out of nowhere. That's exactly where heel raises come in. Simple, yes, but incredibly effective when done correctly. To start, stand behind a sturdy chair, kitchen counter, or even the edge of a sink, something stable you can lightly hold onto for balance. Your feet should be about hip width apart, flat on the ground, with your weight evenly distributed. Now, slowly rise up onto the balls of your feet. Don't rush this part. Take about 2 to 3 seconds to lift your heels off the ground. As you rise, you should feel your calf muscles tighten and engage. That's your pump turning back on. Once you're at the top, hold that position for about 2 seconds. This pause is important. It gives your muscles time to fully contract and push fluid upward. Then gently lower your heels back down to the floor over another 2 to 3 seconds. Avoid dropping quickly. The controlled movement is what makes this exercise effective, especially for circulation. Start with 10 repetitions. If that feels comfortable, gradually work your way up to 15 or even 20. For most seniors, doing this once in the morning and once later in the day, especially before dinner, can make a noticeable difference. Now, if balance is a concern, there's a simple adjustment. You can perform this movement seated. Sit upright in a chair, feet flat on the floor, and raise your heels while keeping your toes planted. It's a smaller range of motion, but it still activates the calf muscles and supports circulation. Here's something I always tell my patients. Consistency matters more than intensity. You don't need to push hard or feel strain. In fact, if you feel pain or cramping, that's a sign to slow down. Over time, what you're doing is retraining your body to move fluid efficiently again. And many people begin to notice that their legs feel lighter, less tight, and less swollen, especially toward the end of the day. But there's another layer to this that often gets overlooked. Even if your muscles are working properly, fluid can still build up, especially if gravity has been working against you all day long. So the next question becomes, what's the simplest way to use gravity to your advantage instead of fighting it? 3. Leg elevation. Let gravity do the work your body struggles to do. By late afternoon, do your legs feel heavier than they did in the morning? Almost like they're carrying extra weight that wasn't there before? That's not your imagination. And it's not just fatigue. What you're feeling is fluid slowly settling downward throughout the day. After 60, your circulation doesn't rebound as quickly, and gravity begins to win. The longer you sit or stand, the more fluid collects in your lower legs and ankles. That's why many people notice swelling gets worse in the evening, not the morning. Now, here's the interesting part. Your body already has a built-in way to fix this, but most people never use it properly. It's called leg elevation. But to make this truly effective, not just something you try once in a while, you need to do it with intention. Start by finding a comfortable place where you can lie flat. A bed, a couch, or even a carpeted floor works fine. Once you're lying down, place pillows under your legs so that your feet are elevated above the level of your heart. This detail is important. If your legs are only slightly raised, you won't get the full benefit. You want gravity to assist your circulation, not just relieve pressure. Your legs should feel supported, not strained. A slight bend at the knees is perfectly fine. This isn't about forcing a position, it's about allowing fluid to move naturally back toward your upper body. Stay in this position for about 15 to 20 minutes. During this time, try to relax your body completely. Avoid checking your phone or tensing your muscles. The more relaxed you are, the more efficiently your body can shift fluid out of your lower legs. Some patients even notice a subtle sensation like a light draining or soft pulsing in their legs. That's often a sign that circulation is improving. The best time to do this is later in the day, especially if you've been on your feet or sitting for extended periods. Many of my patients make it part of their evening routine, right before dinner or while watching the news. And here's something I want you to understand clearly. This isn't just about comfort. When fluid sits in your lower legs for too long, it increases pressure on your skin and tissues. Over time, that can lead to skin breakdown, irritation, and even infections in more serious cases. Leg elevation helps prevent that by giving your body a chance to reset. If getting down on a better floor is difficult, you can modify this by lying on a recliner and raising your legs as high as possible. It may not be perfect, but it's still beneficial. Consistency matters more than perfection here. Done daily, this simple habit can significantly reduce swelling, improve comfort, and help your legs feel lighter and more responsive. But here's something most people overlook. Even when you elevate your legs regularly, swelling can still return if your joints and ankles have become stiff over time, because fluid doesn't just need to move upward, it needs space to move through. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Seated marching, a gentle way to restart circulation without standing. It often surprises people when I tell them this. You don't have to stand up or even break a sweat to start reducing swelling in your legs. In fact, some of the most effective circulation work can be done while you're sitting comfortably in your favorite chair. I've worked with many older adults who say, "Doctor, I just don't feel steady enough to exercise." And that's completely valid. Balance changes with age. Energy levels fluctuate. But that doesn't mean your circulation has to suffer. This is where seated marching becomes incredibly valuable. It's simple, safe, and directly targets the areas where fluid tends to build up. Here's how to do it the right way. Sit in a firm, stable chair, not something too soft where you sink in. Your feet should be flat on the floor and your back supported. Rest your hands lightly on the sides of the chair or on your thighs. Now slowly lift one knee upward as if you're marching in place, but while seated. You don't need to lift it very high. Even a few inches off the ground is enough to activate the muscles in your thigh and hip. Hold that position for about 1 second, then gently lower your foot back down. Now switch to the other leg. Continue alternating back and forth in a slow, steady rhythm. This isn't about speed, it's about control. Aim for about 1 to 2 minutes at a time. If that feels easy, you can gradually increase to 3 minutes, but even short sessions done consistently can make a noticeable difference. So what's really happening here? Each time you lift your leg, you're engaging large muscle groups in your thighs and hips. These muscles help move blood and fluid upward, reducing the pooling that leads to swelling in your lower legs and ankles. At the same time, you're gently stimulating circulation without putting stress on your joints or risking a fall. That's especially important if you spend long periods sitting, watching TV, reading, or even traveling in a car. Here's a practical way to make this part of your routine. Do a short session during every commercial break or every time you finish a chapter of a book. It doesn't have to feel like exercise. It just needs to happen regularly. Now, a small but important detail. Keep your breathing relaxed. Don't hold your breath while lifting your legs. Gentle, steady breathing helps your circulation even more. And if lifting one leg at a time feels too challenging, you can start by simply shifting your weight and lightly lifting your heels while seated. That's your starting point. Over time, as your strength improves, you may find it easier to lift your knees higher and move more confidently. But here's something many people overlook. Movement alone isn't always enough. You can do all the right exercises, stay active, and still notice swelling returning. Why? Because sometimes the issue isn't just how your body moves fluid, it's how your body is holding on to it in the first place. And the next movement I'm about to show you may look small, but it plays a surprisingly powerful role in unlocking that hidden piece. 5. Foot circles, the smallest movement that unlocks stubborn swelling. It doesn't take a big movement to fix a stubborn problem. Sometimes it takes a very precise one. I remember a patient in his late 60s telling me, "Doc, I walk every day, but my ankles still swell." And when I examined him, the issue wasn't a lack of movement. It was a lack of mobility, especially around the ankle joint. You see, your ankles are like gateways. If they become stiff or restricted, fluid doesn't move through the area the way it should. Even if your circulation is decent, that stiffness can quietly trap fluid right where you don't want it around your feet and ankles. That's where foot circles come in. Simple, yes, but when done correctly, they can restore motion, improve flow, and help release that stuck feeling many seniors describe. Here's how to do it effectively. Sit comfortably in a chair or lie down on your bed, whichever feels more stable for you. Gently lift one foot off the ground. You don't need to raise it high, just enough so it can move freely without touching the floor. Now, slowly begin to rotate your foot in a circular motion. Imagine you're drawing a circle in the air with your toes. Go as wide as you comfortably can, but don't force it. The movement should feel smooth, not strained. If your ankle feels tight, that's okay. That's actually a sign you're targeting the right area. Complete about 10 slow circles in one direction, then pause briefly and reverse the direction for another 10 circles. After that, switch to the other foot and repeat the same process. Now, here's what makes this movement truly effective, and most people overlook this part. Speed matters. If you move too quickly, your joints don't fully engage. Instead, slow it down. Each full circle should take about 3 to 4 seconds. This allows the small stabilizing muscles and connective tissues around your ankle to activate and loosen up. You may feel slight stiffness or even hear a soft clicking sound. As long as there's no pain, that's completely normal. It's your joint regaining movement. Breathing also plays a role here. Try not to hold your breath. Stay relaxed. Let the movement be gentle and controlled. You can do this once in the morning to reduce stiffness when you wake up, and again in the evening when swelling tends to be at its worst. For many of my older patients, this becomes a quiet daily habit, something they do while sitting in their favorite chair or even during a phone call. And over time, something interesting happens. Your ankles begin to feel lighter, more flexible, less tight at the end of the day. Because what you're really doing here isn't just moving your foot, you're restoring a pathway. You're allowing fluid to move freely again instead of getting stuck. But here's the deeper truth most people don't realize. Even if you do all 5 of these movements consistently, there's still one internal factor that can keep pulling fluid back into your legs, almost like a hidden force working against you. And if you don't address that part, the swelling may keep coming back no matter how much you move. The truth about swollen legs after 60, what your body is really asking you to do. If there's one thing I hope you take away from everything we've talked about, it's this. Swollen legs and ankles are not just a surface problem. They're a quiet signal from your body that something deeper needs attention. At this stage of life, your body becomes more sensitive to small changes. Muscles don't activate as quickly, circulation slows down, and joints lose flexibility. None of this happens overnight. It builds gradually, often without pain at first. That's why so many older adults dismiss swelling as normal aging. But the truth is, what feels normal today can quietly become a limitation tomorrow. Think about what we've just gone through. None of these movements are intense. They don't require a gym, special equipment, or even much time. But together, they do something incredibly important. They restore motion where your body has started to become still. And that stillness, more than anything, is what allows fluid to collect, pressure to build, and discomfort to grow. Now, here's something many people don't consider. The hours when your body is most vulnerable aren't always during the day, they're at night. When you're lying still for long periods, circulation depends even more on how well your body has been functioning throughout the day. If fluid has been pooling in your legs for hours, your body has to work harder while you sleep to rebalance itself. Over time, that can affect not just swelling, but also how rested you feel in the morning, your balance when you get up, and even your risk of falls. Looking ahead 1 to 5 years, this is where small habits begin to shape bigger outcomes. If swelling continues unchecked, it can lead to tighter skin, reduced mobility, and a greater dependence on others for simple daily tasks. But if you begin supporting your circulation now, even with simple, consistent movements, you give your body a chance to maintain independence, stability, and comfort. This isn't about doing everything perfectly. It's about understanding your body well enough to respond before problems grow. The difference between someone who stays active into their 70s and 80s and someone who struggles with mobility often comes down to these quiet, daily choices. So don't ignore what your legs are telling you. Don't wait until swelling becomes pain or until movement becomes difficult. Because the goal isn't just to reduce swelling today, it's to protect how you live tomorrow. And there's one more factor, something most people completely overlook, that can silently worsen swelling no matter how much you move. And it may already be part of your daily routine. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.